Good morning, everybody. My name is Dr. Patrick Flynn, and welcome to A Different Perspective. I am so excited that you guys are with me today, but I'm even more excited that I am back for being gone for almost 11 days, almost 12 days that way. So nice to be back in studio. I want to thank the docs and everybody that covered the shows when I was gone. Appreciate all the great information that they gave out. We have such amazing people, an array of doctors and practitioners that can do this show when I'm gone traveling all over. So thank you so much. I do appreciate it that way. So hope you guys are doing well. I'm excited to be back here. It's it's great to be back in the United States. Great to be back in Wisconsin. Love being here with everybody that way. So getting ready for an awesome show today. By special request, we're changing the show a little bit, so we're going to have a lot of fun. But hope you guys are having a wonderful Saturday. Looking forward to spend some time with you. And before we get started, just want to announce a couple things. First of all, as you guys know, as we continue to do our stuff, we will be live on all our platforms that way. But I want to let you guys know, remember, go to our website. The majority of you guys watch it on adp.thewellnessway.com. You will see on our website that we have the greatest things out there that people can see. Most of you guys are watching it right now. You can also see, for example, our Find a Clinic. It's a lot of people say, Doc, I know you have clinics all over. Where are they? Well, you can go to the findaclinic.com, but the easiest way to know what we're doing on a regular basis, you can see from our nice little video here, is go to our website and sign up on the newsletter there. It's simple, it's free, it's amazing. We put out so much information. I know I'm fascinated. I know I talk about some of the same things all the time, but I am so fascinated, as you can see, as you just submit your email address that way, you will get everything from these amazing newsletters. Just type your email address in, subscribe. There's no charge. We do not spam you. But the one thing that we do is the fact that it's like I was looking at even this morning, our amazing information that you get. We have great investigative journalists. We have great videos that go out. And we get so many hits all around the world that watch our stuff and read our stuff. I'm excited to actually have a part of it and everything we do. But remember, we actually are back a little bit on some live pages. Remember, we have the DPF page back, and it's growing on a regular basis. We have our Instagram. We have our Wellness Way YouTube page that you guys are on right now. Also, once again, the website still is we try to draw everybody there because it's the one place they cannot center. But it's kind of funny. My Instagram is still kind of going crazy. I don't know why. I think I do. I think all the amazing reels that we are doing on a regular basis with our team, the things that Miranda and Joshua and McKinley and all of our marketing team is putting together, people are just going to our Instagram, and we are just, I literally get hundreds of questions a day, which leads into something that we're going to do today. I got a special request, and usually I have more topics because I have so many topics people want, but people say, Doc, we've been watching your reels, and you've been doing a nice little short, 30-second minute question answer. Can you do a long format question answer? So I'm like, yes, that sounds like a great plan for today. But before we get started, as you guys know, last time I was here, we had some of our wonderful interns start. You saw Dr. Carolyn Conley come up and say hi to everybody. But we get a ton of great interns, future docs. So what we're going to do is we're going to bring them all up here right now. Dr. Conley, come back up here too. But the difference is it's kind of cool. I would tell you this. Our amazing media team and everything like that, I got mics everywhere now. It's kind of cool. I'm like, and Travis came up to me and said, hey, they're live. So we're gonna bring the interns up here for a second, and they're just going to tell you where they're from and actually who they are. So come on up, guys. And some of you guys know Carolyn from the other day and Patrick from Answering the Questions. Come on up. Stand right next to me. This is, once again, they didn't know that they were doing this, so they're like, they did their hair and everything that way. So what I'm just going to have you guys do, come on jamming towards me. Yeah, so then what we'll do is this. Yep, they'll come in, and we'll just, Patrick will have you introduce yourself first, and then we'll have you step off and sit down. But introduce yourself and where you're from.
I'm Patrick, and I'm from St. Louis, Missouri.
Hey, I'm Jenny. I'm from Buffalo Grove, Illinois.
Yes, but Jenny what? What's your last name?
Schultz.
Yes, they already met Patrick, right? So they already know his name. Right? So, Leslie.
Hi, I'm Leslie Ackerman. I'm from Orlando, Florida.
Hi, I'm Tristan Powell from Whitehall, Wisconsin.
Yeah, and Carolyn, why don't you tell them again?
Hi, I'm Caroline Connolly. I'm from Newbie, New York.
Awesome. So these are the wonderful interns that we have on a regular basis that come on, and you guys all graduate within the next 6 months, correct? Some of you guys in a couple months that way. As you guys know, Patrick has been here for a while interning. He's now going to another one of our offices, but he's one also doing a bunch of the Q&A stuff with us as far as what we're doing today. So, all right, thanks, guys. Awesome. These are great individuals. They train hard. We push them hard because you know why? Because they are going to have the answers for what's going on with you health-wise. And no joke, and I push them hard. You think I'm joking? I've made interns cry. Now, not being mean to them, just pushing them, because you know why? Because you're going to find out that our practitioners are trained at such a high level that when you are sick and suffering, I want these guys to have the answers. I do. Because you know why? Because there's, and I'm going to talk about it today, my travels, no matter where I go, no matter what country I'm in, no matter, I don't care what your background is, I don't care if you're a male, I don't care if you're a female, I don't care if you're what religion you are, there's one universal thing I can honestly tell you that I've seen across the world. It's sick and suffering people, which I want to talk about today is I was gone for the last basically 12 days. I left, went down to Pensacola, Florida, went over to Atlanta, and then I flew across seas over to Ireland. And as I said before, June 10th when I was down in Pensacola, because I was just down there recently, about a month ago, and did my last hormone talk in the U.S. I said it was my last talk in the U.S. I had one more talk. I kept it quiet because I just was over in Ireland and had a wonderful talk with such amazing people. But I don't know if you guys have ever been there just as far as a country itself. Now, obviously, as you know, my name is Patrick Michael Flynn. I don't think I could be more Irish than I really am, but it's kind of cool. It's where my heritage is from. It's kind of cool. But the idea is I got to go there because we have an amazing office with Dr. Page in Galway. Okay, it's on the west side of the island. It's awesome if you've ever been there. So you fly into Dublin and you take a car across, and it's about a 2.5 hour drive, and just seeing the countryside and everything. And then, as you know, it's kind of cool. As you guys know, that we love golf. So I actually got to golf on some amazing links courses. And you should see this countryside. I mean, take a look at this. I mean, that's the ocean in the background, and just imagine the rolling hills in stone like crazy. I mean, it was just massive stone formations. You cannot do it justice. That is so beautiful. You can see the nice little flag down there. And yes, I did par that hole. It was pretty awesome. So actually, cool thing is I birdied number 18. It was kind of nice. It was par 5. Made it there in 2. If you're a golfer, you understand what that means. 505 yards. Just crushed the ball off the drive, and then actually took and set the thing, and I missed the eagle putt, but it's kind of cool. I still got a birdie to end my golf round in my last golf round in Ireland, but absolutely incredible. But it's kind of cool because I didn't realize I got to talk on Tuesday night, and this wonderful, wonderful woman walks up to me, and with her Irish accent, and it's kind of cool. And she's like, "Doc, I am your biggest fan in Ireland. Nobody loves you more than me." And it was kind of cool. And what she did, and she brought a slew of people with her. I'm like, oh my goodness. And it was great. And she actually even said some quite amazing things just by watching our videos and watching our things. She said, listen, she goes, somebody shared it on Facebook, and then all of a sudden I just caught it. You started to make a lot of sense. I started applying stuff to my life, and then I started sharing with my other friends. And see, that's a big thing, guys. This is just a free show with information. That's it. And yes, isn't it funny? I know we get censored. I know that I had to restart my Dr. Patrick Flynn page. I get it. You know, is it frustrating sometimes? Truly. But you know what happens? When you have something good to share with people, you don't have to worry about censorship. You really don't. They can slow you down, but they can't stop you. I've always said this before, is I started this company way before I even got on media. Way before. I was in practice for a long time, for 15 years before I even made a YouTube or a Facebook post and everything. So I'm very happy for media. I get to connect with a lot of you guys there, and it does broaden your reach. But the idea is this, is when you have something good to share with people, they're going to find it, because you know why? As I said, something universal, I'm going to talk about my last 10%. People are sick all over the world. Now, the great thing is also, is I got to jump over to England and got to see London, which was kind of cool. As you can see Big Ben in the background, and I think that's the was it the Parliament or whatever it is that's next to it. I don't know. I know it's Big Ben. I stood right next to it, took a picture. It was kind of great. But the idea is this: is what a wonderful city. Definitely a wonderful place to come visit. And I never noticed that, but they have coffee shops on top of coffee shops. Except for if you ask for coffee at like 7, 8 o'clock at night, they're like, coffee's done. I'm like, come on, coffee's never done. So it was kind of great going there. Met some amazing people there. And just let you know that we will have offices expanding in the European countries very soon, as we have now become an international brand. And so it's nice to go over there and see where we potentially have different offices and that. So I know a lot of people say, we have a huge, next to US, our biggest following is actually in Australia. We have people say, oh my goodness, Doc, are you getting an office down there? Yes, we eventually will. There is no doubt. And I'm very, very excited about that, because I want people to see what's going on. So the travels were great that way. Also, I learned something. I don't know if you guys know this, but so I was in London, and all of a sudden you can see a picture here. It's of the, now here's what I called it. When I went there, I'm like, I want to go see London Bridge. And the locals were like, what are you talking about? And I was kind of like, wait, what do you mean? Because you can see, this is Tower Bridge. It's the one you see on all the movies and things like that. And I realized, and the person said to me, don't you remember the children's nursery rhyme? I'm like, what that? They're like, London Bridges. I was like, oh. And the person points down the river and says, see all those bridges? That's London Bridges. There is no London Bridge. I'm like, I've been lied to my whole childhood. You know what I'm saying? I was like, yeah. So it's Tower Bridge, the one you see on all the movies and all stuff like that. And so I went and I walked right across Tower Bridge, and it was kind of fantastic. So yes, so it's called London Bridges falling down, and there's multiple bridges. It's not just one. I was lied to as a child. Yeah, because you did. It was kind of cool. So I literally went there and said, I want to go see London Bridge. Like the locals were like, what are you talking about? And then one woman I was talking about, she goes, oh, you're related to the nursery rhyme. So it was kind of cool. So I learned something even on my travels there, which was quite cool. So now, that being said, is going forward, remember, as I have wind down now all my hormone talks, people have asked me, it's one question I'll talk about before we get into our Q&A in a little bit. They say, Doc, will you ever speak again? Because the one thing that I can honestly tell you, I kind of shed a tear in front of everybody on Tuesday night because I actually, it was my when I was down by Dr. Devin in Pensacola, it was very emotional because it was my last U.S. talk. But I realized that my true last hormone talk was in Ireland. And no joke, I actually shed a tear in front of everybody after I got a standing ovation from all the wonderful people in Ireland. I can't thank you enough. It meant so much. And it was interesting because we had such a packed house, and you're gonna find this funny. There was 2 guys there. It was all women. And I understand with this topic, but it's really funny because as we talked about before, the number one complaint in my seminar is when people are done with it, they said, I wish my husband would have been there. Well, that was the common theme after we came there because most people think hormones and stuff are about women. Yes, they have a little bit more complex hormonal system, but guys are just as hormonal. It's just a little different than women, so they don't think they are. So after it's done, all the women are like, my husband should have been here. Are you sure you can't come back and do another one? I'm like, nope, but I will tell you this. That doesn't mean that someday I won't speak again and have a seminar that has some of the similar material. So for all you guys who are asking that, and I've been getting so many of those emails, just hang in there. Like I said, it's just a season of life as things are changing and growing as we are becoming a great company, as you see all these amazing interns that will be docs providing this kind of care all over the world. It's hard not to go out and share it as people pack in hotels and conference centers when I go speak. It's kind of great. So, and I do have our speaking events that I'm going to be speaking at other people's conferences, but we'll start something up maybe sometime. Like I always said, people say, Doc, will you ever speak again? I said, hey, even Garth Brooks came out of retirement, saying he came back, so it's kind of cool. But the one thing I do want to talk about, and you're going to see from our amazing media and editing team, from Eric and Travis and Kyle and Joshua and that. Next week, we're going to have an information promo. The one thing that I want you guys to understand, every office, as you see when you go to the website, thewellnessway.com, we have great talks that go on almost every other week, if not every week, in the local offices. So our main talk that really sets the foundation to learn everything, because I know a lot of you guys watch this brand new, find a local office and go see one of the information talks. It's fantastic. They have them at different times. Most of them have them on Tuesdays or Thursdays, and they have them usually around 6:30 or 6 o'clock that way. It's the basis. The Hormone Connection Seminar, yes, I know it's very impactful, very funny. You learn a lot that way. But believe it or not, the best talk is actually an information talk. And every doctor from every office across the world does it. So definitely go and see them. It's something that needs to be done on a regular basis. It sets the foundation for everything that we do. Because when you understand the foundation, then the clinical results come. And what I want to share with you now is something that we're going to do on a regular basis. You're going to see these videos come out. But the one thing that we are so proud of, and I tell people, I'm not really a speaker. I'm not really a person that hosts a show. I always tell people, don't forget this. What built our company in the first place and what built everything, even else, the people for us to watch us, is the clinical outcomes that we massively desire. These amazing docs are here to train, not to learn to do media. Now, once again, will they all learn to do media? Absolutely, because you want to see them share their experiences and what they see in their office. But the end result is this. They're sick and suffering everywhere. And you'd be surprised at the stuff that comes in our doors every day. And so having the best clinical outcomes is still the objective of the Wellness Way. That's it. That's all I care about. And me leading this company all over the world, trust me, There are sick people that need these kind of answers. And what we're going to do now is I'm going to share a wonderful story. And remember, we have these constantly, but I want to share one story that you're going to see in a little video here with Dr. Sam, an amazing individual that is going to show you why we do what we do and why these interns and why other doctors and other professionals come and train with us. Because when you see results like this, you can't argue with them, and watch what it does to people's lives. So watch this amazing video.
Hey guys, I am Dr. Sam Wagner here at the Wellness Way Green Bay. I specialize in sports medicine and some other soft tissue work, but today is not about me. I am incredibly fortunate to be able to share with you a very powerful story about a patient of mine that was able to get their health back. This story I know will resonate with a lot of individuals. So I personally am really excited to share that with all of you today.
I'm a heavy equipment operator. I've been doing it for like 14 years, and I really enjoy my job. I got dizzy at work and went in to see a regular doctor, and the doctor was telling me that I had an inner ear infection. So I'm like, okay, so he's giving me medication, I had an inner ear infection, and then a year later, after my yearly visit come back, she said, how's your diabetes doing? And I'm like, diabetes? I didn't have diabetes. And then next thing you know, which I believed in the doctors, you know, doctors are honest, they tell you the truth. So I believed them. So I started taking their medications, diabetes medication. Next thing you know, a couple months later, my eyesight started going bad. She said, that's because of your diabetes. I think it's because of the medication. But I didn't realize 10 years ago that I was misled. And every 6 months after that, the doctor kept saying, you're getting worse, you're getting worse, you're getting worse. And I was believing them. Of course I was. I was feeling worse. They kept upping my medication and I kept getting worse and worse and worse. Couldn't get out of bed. When I got out of bed, I was always in pain, I was sore. I gained tons of weight. And I thought, there's got to be something better than this. Well, before Wellness Way, my wife's like, you know, I've been looking this place up. We should go forget these doctors and go up there and try this out. And then I had a doctor's appointment coming up within a couple days. And the nurse calls me and she says, it's getting so bad, they'll probably have to put you on insulin. I looked at the wife, I was like, no, I'm not going on insulin, I'm not doing that. So we came here. And that's when it all began. I got a doctor whose name's Sam, and he's been great. He's amazing. He told me that you don't have to keep me forever. Where your other doctors, your normal doctors, you'd say, you'll see him the rest of your life. Sam's like, I'm gonna let you go. You're gonna be better. And that was the truth. They healed me, which I've never ever had a doctor do that before. I never had a doctor go step by step through all your food allergies and everything, what's wrong with you, and put it on a big screen to show you all your numbers. My regular doctor never did that. All he did was say, you're sick, this is what's wrong with you, this is the medication you need, and you're on your way. You're there for 2 minutes. This doctor, Sam, you're there for half hour, 20 minutes, and you feel amazing because this man tells you what you need to do. And if you do it, you become a whole new person and you get healthy. Through this whole process, it's not easy. I mean, you got to give up things that you thought in your entire life you never get rid of. Like, I was allergic to like tomatoes. So there goes pizza, there goes lasagna. It's a hard obstacle to get over. It's like, how am I going to get rid of pizza? I mean, pizza's like American food. I mean, everybody loves pizza, but I love my health more than I do pizza. And the biggest obstacle is getting rid of my, I had a yeast, Brewer's yeast allergy, so I had to give up beer. I love beer, but I don't need it. I always felt bloated. I always felt, woke up the next day, didn't know what happened because I was always, overindulged in beer. And now I got a better life. And I'm glad I'm married to that because I got a much better life. I'm getting more respect now because I look different. I'm skinnier and I look healthier. I'm happier. I'm always smiling. I'm always in a good mood. I never was like that. I was always an old grumpy old man, which now I feel like a young man, but I look old. It makes me feel great when people are like, what happened to you? What are you sick? Are you got cancer? Or, like, no, I'm healthy now. I'm finally healthy. It's amazing. And I owe it to this place, but they keep telling me, the doctor's telling me that, no, they owe it, it's me, I'm the one that did it. But I couldn't have done it without their guidance. If I didn't have their guidance, I could have never got what I got. Could have never ended up the way I am. If you haven't got tested, get tested. It'll lead you to health. And it's the best thing I ever did in my entire life is come here. Don't wait. Don't be like me. Don't wait 10 years. Get tested now. Get healthy. Come here. Find Sam or any doctor you choose. But Sam's amazing, and do it for yourself. If you got the willpower to get healthy, come here, get healthy, and become a whole new you. That's what I did. And I'm glad I did that. I would just wish it was 10 years ago. I wish I would have done this years ago. But I'm glad I did it now because it's never too late. Never too late.
We're a global company. We have clinics nationwide. You can find us. We have clinicians everywhere. Stories like that, that's what makes this not a have-to job, but a get-to job. At the end of the day, true health is the best gift you can give yourself. So why not do it?
Wellness Way Stories are glimpses into personal experiences shared between patient and doctors. These insightful stories share the perspective that was captured during their health restoration journey. Be sure to like, comment, and subscribe for more heartfelt content from the Wellness Way. Boy, watching those things each time kind of choke you up a little bit. And as Dr. Sam, first of all, great job, Dr. Sam. Dr. Sam was an intern like these wonderful people, came here, trained hard, and he's only been in practice a little over a year. And the things that he's doing and all the other doctors, and like Dr. Sam said, these are normal stories all over the world. This is what we get to see on a regular basis. And it's something that's so important. And I want to share, like, today is a very, like I say, vulnerable show, because you can see from my graphic behind my head there. we're going to talk, there, shift over here, there we go, and stuff like that. So, no, but what happens is that being said, I can honestly tell you, I'm going to share something with you guys that's pretty emotional for me. That it was about 7 years ago. You know, it was very common for the stories that Dr. Sam showed you. That's a normal thing for us. It really is. And if you see what that man went through and his weight loss aspect and what journey, and he told you it wasn't easy. It's not easy. When you accomplish something great, it's not going to be easy. But the idea is, look at what he said in the end. He's a much healthier, happier individual, and he's now going to live life better than he did for years before. And he kept on talking about the experience that he had going forward, and that's very common for all the doctors that we share with and practitioners. And you'll hear me say this a lot. You'll hear me say doctors and practitioners. Now, why do I say that? Because there's some people that have degrees as doctors, and there's some people that don't. I can honestly tell you, so I want to tell you a little story. Because I have something, and like I said, as you see the logos behind me, I'll put my head right in the middle so you can still see the academy there. It kind of looks like a one of those Catholic mirrors now. It has the halo over the top. See that? Like stained glass. I know, guys. I kind of wonder why most of you guys watch this show. But anyways, as you can see, the Wellness Way Academy. So let me tell you something. A true story. The Wellness Way Academy came from a compilation of many thoughts that I had that got rejected, even externally and internally. I started, like I told you, I'm quite vulnerable about it that way, because we live in a world of experts, and I'm gonna tell you right now, I think that is one of the dumbest things on the planet. It is, because experts are wrong most of the time. Don't believe me, what happened over the last 2 years. But what you've seen over the last 2 years is something I've seen for a long time. Because what happens is they get so focused on something so minute. For example, let me step back and give you a little example of how I think. I believe that we need specialists in the world. Now let me explain. If all of a sudden you actually have a brain tumor, I would not want a podiatrist or a foot surgeon to come in to work on it. I get it. There's some areas that it's okay to be specialized in. But the body is not a specialized thing when you want to accomplish something different. Now, what do I mean? If you are sick and have a disease and you have a tumor, guess what happens? You're already not healthy. You are not, okay? And I'm going to cover that in my last 10%, so I don't want to get into too much of that. But the idea is this. So therefore, if you want to extend your life, you may need a very specialized surgeon that can do what? That can operate and take care of it. It's like this. If I have a cardiovascular event, if I have a heart attack, I would want a cardiologist or some surgeon to be able to, remove the blockage or put a stent in. Great. But the idea is this, is they're specialized in one area. And I've kind of defined a specialist, and I know it's going to sound derogatory, but I want you to think about this. A specialist is a person that knows more and more about less and less. I want you to think about that. A specialist is a person that knows more and more about less and less. Now, that's why if you ever notice this, let me go back to something that a lot of people do not know. But first of all, I want to welcome, and he doesn't know I'm doing this before I go on. It's like one of my dear friends, but also Brandon's father-in-law. Chad's in here today because it's actually kind of cool. So we were talking about this because Chad and I are roughly the same age, and of course talking about health things that way. But imagine this. If you look at when a person has like a cardiovascular event, you want somebody to walk in and be like, hey, listen, I want somebody to perform heart surgery. That's great. And they have such a minute perspective on this. But Chad and I talked about this a long time ago, and that's why I brought him up, is if you think about it this way, when an individual, let's say our age, because I'm going to be 48 this year and stuff, and but Chad, you're what now, 52? Gonna be 52, yeah. And so people that are our age, they'll say like, okay, guess what? He asked me a question we're gonna cover on our live today. But they're like, okay, you're at the age, you got to worry about heart things. You might need to take a baby aspirin today and this and this. It's kind of funny because one common thing that came out in the 80s, and you guys remember this if you're our age, they came out and said, an aspirin a day is good for your heart. How many of you guys remember that? Now, if you are a specialist, if you are somebody that is a cardiovascular specialist, and I've even had conversations with them. Remember, one of my very dear friends is the cardiovascular surgeon at Aurora Hospital. And they're even taught, say, listen, that if you take an aspirin a day, the thinning of the blood and the coagulation and everything, it's actually good for the heart. And they can sit there and they're specialized one compartment, and no doubt they can even research it. They can put every article on PubMed showing that aspirin a day is great for the heart. Yes, because they're specialized in one area. He's an expert in one area. But I will tell you this, experts so look at the trees that they can't understand the forest. So they so look at their one tree, and they talk about their one tree, they can justify it, and that's their thinking. And I'm cool with that. What do I mean? For example, if somebody does have a heart attack or a blocked artery, I want the specialist to do that. If somebody does have a brain tumor, something that has, I'm cool if you are specialized to be able to do that. But, and there's the big part, there's the big but. But to act like your expertise is the only way to look at something, I can't get on that. You know, Sam? Because you know why? Because the minute that they said an aspirin a day was good for the heart, it became standard practice for all the experts out there. You know what's really funny though? The one thing is, I know some other experts, and they're experts of neurology, brain surgeons included. We've had Dr. Blaylock and other brain surgeons on here, and they will tell you right out that an aspirin a day is good for the heart, but it's one of the number one reasons today that people have stroke. For example, if you look at somebody that has a stroke, or I apologize, if you look at somebody that had some cardiovascular event, they put you on a baby aspirin per day or an aspirin today. What happens when that person is walking along something and accidentally bumps their arm? What happens to their arm? See, everybody knows it. It bruises. Because you know why? Because that aspirin and its job, doing its job the way it's supposed to, it's not a side effect. Its normal job is actually to create some thinning and also thins the blood vessels. And if you know anything of the body, because you look at the trees, not the forest, because in the artery you have some very big vessels and everything like that. So taking it, guess what happens? Helps heart beats easier, less chance of actually blockages. But in the brain, you have very small capillaries that burst. And by nature, that's called a stroke. And since that has come out in the 80s, stroke has become one of the number one killers across the world. It wasn't even in the top 10 till the experts came out and said, hey, listen, an aspirin a day is good for the heart. See, that's why when people say, well, Dr. Fauci's an expert at this, I don't care what he's an expert at. It's like this. Watch this. Can you stimulate the immune system by a drug or a vaccine or something like that and actually even catch a virus? I don't disagree with that. I don't. I could actually even pull your blood and show you what happens post certain immune cells by doing it. But they're looking at their small area. Remember, a specialist is a person that knows more and more about less and less. And they're so looking at their little aspect that when that immune response catches the virus, it also can destroy an organ and cause an autoimmune disease and damage your liver and your brain and even your heart, called myocarditis. But they say, don't worry, that's just a side effect. It's not a side effect, it's a direct effect. But your experts are wrong when they're trying to look at the body as one little gear. And that's why I said I can never agree with them. I only have a problem if you say just within my little system and my little view on the body that we can do these things. See, and that's why as people started to learn this, and that's what the whole Wellness Way Academy has come on. See, I found out a long time ago, being in practice, that people sometimes find their passions later in life. Sometimes if you're like these young docs or like I was, man, guys, think about this. I started developing everything you see today when I was not only a teenager, but really when I became a doc at 24. And people, I want you to imagine that your son or your daughter or you right now are 24 years old, and you had to develop everything that I've already put in place. And I realized, and I had people come to me that were 40 years old and said, Doc, oh my goodness, I don't want to go through the schooling that you went through in order to develop what you did. And I sat back, and I remember saying it to this woman who was actually 42 years old, and now she was one of our first ever academy graduates. And she's like, my goodness, I wish I would have learned about this when I was younger. And she goes, because I can't go through the amount of schooling that you went through and things like that. And I said something to her. And I said something to her that I actually didn't realize, but changed my life, and it stemmed the idea of what I'm going to share with you. Stemmed the idea of going, do you understand that the majority of my school is bullshit? Do you understand college is all bullshit? Do you understand that even my good professors still didn't do anything in the world? They sat back and taught. As you guys know, I love politics, I love economics that way. Somebody tell me an economist that's successful or rich in life. They're not. They get a wage. You're really actually kind of poor. See, it's like, and I mean that, don't mean that negative, because you need professors, but you understand the majority of professors, the majority of college is actually dumb. It really is. If you didn't have to jump through the hoops to get a license, I can honestly tell you this. 99% of stuff the Wellness Way does, I never learned in college. This is not a joke. I didn't think, sorry GB, sorry Palmer, sorry all the schools, sorry all the things that way. Did it give me some idea of the immune system? Yes, absolutely. But I could have done that on my own. I love reading textbooks. But the idea is this, I didn't need college to develop what I developed. And I realized I'm going, oh my goodness, most of college in any field is a bunch of bullcrap. Actually, if you think of it this way, the medical field is just a fraternity of people that can pass out legal drugs. That's it. Do you understand? That's all it is. You have to be part of the group. And if you're not part of the group or think like a group, they kick you out. We've seen that over the last couple of years. Doctors that think outside their box, their specialty. But the idea is, so I sat there and I'm going, wait, it is all bull crap. It really is. The majority of it is. And I can honestly tell you, and I will say this in a very respectful way. Every doctor that is with Wellness Way, guess what happens? They didn't know the stuff before they started with us. They didn't. They did not. Not a joke. That's not demeaning to them. They went to schools, just even some of the similar schools I did that way, but they didn't learn it in school. They had to learn it from right here. From right here. This building. This brain right here. And I started doing videos. I started teaching a long time ago. And I was like going, you know what some is this? And what is really a school? A government approved, actually it's really funny. If people say accredited school. Do you know what accredited school is? Something that can give you a student loan. That's it. So you have to jump through their hoops that you follow their rules. I'm like, really? How are we doing for student loan debt? How are we doing for our graduates that have no jobs? And I started to go, man, you know something is this? I drew the public in from getting the great clinical results that none of my schools taught me. I'm like, what if I could now teach current doctors, nurses, and the person that was 42 years old, and the person that was, she wasn't in the health field. She wasn't at all. Actually, to tell you the truth, she was a stay-home mom. But what happened is, as her health changed, she started to become passionate about, and she told everybody, and when I was listening to her talk, she sounded just like a doc. I'm like, what if I could teach her? What if I could teach her? So I came up with an idea going, you know something? I'm going to do my own school. And that's how the academy got birthed. And it's really funny. And I got pushback. And I mean, a pushback, it was like, well, they're not a doc. And I looked at the doctors in my company. I looked at the doctors out in the public and said, do you understand everything I taught you? You didn't learn at school either. They sat back. And I was like, true. All the hormone stuff that I teach all over the world, guess what happens? Doctors are not taught that in any school. Zero. None. And I sat there and went, but what if we had a Wellness Way Academy and started training individuals to the point? I can give you an example. I have a guy who actually graduated 8th grade. He was part of the Amish community. And he didn't get any more than an 8th grade education. And he gets the same results as Dr. Sam that you saw in that video. He gets the same results as me. Because learning and trying to fit into a pool, that's why I laugh when people have all these experts on TV. I'm like, you're just part of a club. But I mean this sincerely. When I got interviewed by Robert F. Kennedy Jr.'s show when it came to talking about fertility, I said, listen, the most you can try to do is target the messenger, but you can't target the message because I got one question. How are we doing? With all the experts, how are we doing as far as health? Which we're going to talk about in my last 10%. So I started the academy going, there's people that are out there that are passionate, that are care about health, that want to see other people accomplish that. And we started it, and it took off like crazy. And don't get me wrong, do we have a ton of medical people? Actually, it's probably the biggest amount of people that do it is actually medical people. Nurses, especially during the pandemic, nurses are like, you know something, with all this crap going on, I actually want to learn how to actually truly take care of people. And that's where the academy stemmed from. So if you're ever interested to take a look at it, no joke, it's the academy. Just go to the wellnesswayacademy.com. You can go through there. It's kind of great because we have classes that start every quarter. And you'd be surprised to see your colleagues, and I can honestly tell you, I love our academy graduates. When I say practitioners, these practitioners are getting no different clinical results than I have for 23 years, that all of our doctors have. And they're amazing. And they stem from all backgrounds. They really do. Because you know something I realized, and no one disagrees with it now. You know something this, I mean this sincerely. And I enjoyed my time at University of Wisconsin, Green Bay, and my other colleges. I actually, no joke, I went to like 7 different colleges, just to let you know. And that's why I know it's kind of funny. That's why people are like, they always try to pin like education against education. I'm sorry. Look at what always happens. I sit there and go, the end result is how we doing and how's that person still doing? Look at the person that went to an expert on Dr. Sam's story. And guess what happens? Just another drug, another drug, another drug. Then came in contact with a practitioner, a doctor, Dr. Sam, that was under 1 year of practice, and look at the clinical results he got, because it was what the thinking that Dr. Sam learned. And Dr. Sam did not learn that in his schooling. He learned it from the Wellness Way. He did. And he had a passion for it. And he started it when he was a student. So he went through his degrees to do certain things. But then what happens is the results he got was almost like being through an academy itself. And that's when these guys are here. I train them hard. I push them hard. Because you know why? Because, just like our academy people, just like our doctors, if your mom, if your grandma, if your dad walk into a Wellness Way office, my practitioners will be ready. And they'll be trained. And they'll be ready to handle what's going on with you. So, that being said, it's time for guys to move into our perspective, which is going to be a great question and answer. Thank you for a ton of questions that came in. So let's move into our perspective moment now. All right, we're back, and welcome Brandon Flynn. We're going to go through some awesome Q&A. Now, here's what you guys got to do. For any platform that you're on, we have the interns on here.
Yep.
We have, Patrick is always on. Patrick, are you on the website? Which one are you on?
Website, Facebook, and...
Good. So we're on all of them.
Yep.
It's in our website, Facebook. I'm going to actually jump on one of the things, but I'm going to jump on my email. So they're going to be on the platforms that way. But if you do have a question, because if we don't get to it, if you send it to the email, I'll probably respond to you personally that way. But you can send an email to askdrpatrick@thewellnessway.com. So askdrpatrick@thewellnessway.com. And I will actually get your email. I'll be reading some of them probably when we're here. But Brandon's going to fire some questions off.
Yep.
Some will take a minute to answer. Some will be a little bit of discussion. But we're going to go through as many as possible that way. So right now it's 8:44. So hopefully we'll do at least 45 minutes of questions. Because then what happens is
we say that and it's like an hour and a half later.
That's a good point. But we have your daughter's birthday party today.
Yeah, so we have to get
Chad's
done.
in town
Yeah,
too.
yeah.
It's that kind of Cora's 1 year old.
Yeah.
My goodness.
Time's flying.
It does fly by.
Wow.
So, all right. So remember, we got the interns. Everybody's going to be asking questions on the post below if they have one. Next, like I said, ask Dr. Patrick at thewellnessway.com, and then let's get going. So what you got, Brandon, first?
All right, first question. What do you recommend for improving libido and vaginal health dryness after menopause?
Okay, that's a very common thing, and I want to step back and talk about something first, because we did a reel on Instagram, and I couldn't believe the amount of pushback that we got back from it. It was like the pushback we got was because people asked the question, does menopause cause pain and things like that? And I said no, and some women lost their mind.
Yeah, I saw that.
I was like, and when I mean by lost their mind, they're like, Doc, I'm suffering. Guys, let's say this. Remember, menopause is just a stage of life. Remember, think this way. If you are roughly 51 to 54 years old in the United States, you're probably going to, if not already be in menopause, but transition that way. And how do you get there? You just had to live long enough. don't want to get to menopause, probably die in your 40s, all right? But that's the point, you know what I'm saying? Is it's a stage of life. And that'd be like saying, being cyclic, all these health problems come up. Well, it's not true. It's just a stage of life that you're cyclic. You're cyclic first off for roughly, from age 14 to 51, okay? That's the average age for United States girls. But then on top of it, menopause is roughly from 51 till you die. It's a stage of life. Menopause does not bring pain and symptoms. Menopause does not bring problems. What brings problems is the fact that you're thinking the doctors you've been under care of. So by the time that you get to menopause, you are inflamed like crazy. So I don't disagree that probably 99% of the women in menopause today have a lot of problems because who you've been taking care of your whole life. You've been taken care of by doctors that don't know how to reduce your inflammation. They cause a lot of problems. They cause you to be unhealthy. And therefore, you get to menopause and it's hell on earth. But it's not menopause. So let's now step back and look at some of the factors that contribute to libido and vaginal dryness. Durham, chronic inflammation is by far the key, which now leads to lower, levels of hormones. Obviously, sex drive is going to be dealt with testosterone. Ladies, your adrenals have a major impact on that. Second of all, your estrogens have a major impact on your vaginal dryness, all right? Estrogens maintain that tissue. So that's why if you ever notice, it's like this. Like your wife's pregnant right now, with baby 2, all right? If you ever look at it this way, she already has good skin, but you understand that pregnant women's skin and hair get even better. Do you know why?
Why? Because
your E4, one of your other estrogens, skyrocket during pregnancy. Some levels drop down, but then E4 goes up, and then skin and hair grow even better. That's the glow. That's the pregnant glow. It's based on some hormone levels that are coming high that only happen during pregnancy. That's why you say women that are pregnant radiate. Well, they kind of do because they have a hormone that skyrockets that needs to be to maintain certain areas of their body. But then if you notice certain levels of hormones change during pregnancy, and that's why one's bodies change. Now, if you remember this, so if a woman gets to menopause and she has aches and pains, if she has vaginal dryness, if she has this, number one, they have some chronic inflammation that's been there for a long time. Your current doctors, just like you saw in Dr. Sam's video, is not going to investigate. They're going to say, well, here's some HRT. Here's some factors you can take, and we'll just give you some synthetic hormones that way that can try to replace that. No, they can be restored back to normal. It's just that, is it easy? No. It's much easier to take some medication that can cause some other negative effects to your body than it is to work your health back to normal. So, yes. Okay. So for you guys that freaked out on my reel saying about, Doc, you don't understand, you're a male. It has nothing to do with me being a male.
No.
Do you understand? I hate to say this, ladies. When I was at the hormone seminar in Ireland, and I said, minus the people that see all my videos, how many of you women knew that estrogen is just a term that describes many hormones, and I said before you met, and then I did this though. I said before you met Dr. Page in the Wellness Way over here, how many of you have had your estrogens, with a plural, tested before you walked into our office? And we had nurses there, we had doctors talk about medical fields, we had pharmacists there that were at the talk, and this was a talk for the public, so it wasn't a teaching seminar for the medical field. It was actually just a lot of medical people there that have been watching our material, and they're like, I've never had them measured, and I went through medical school, and I went through nursing school, I am a pharmacist. And I'm like, wow, and you're 50 and 60 years old, and these hormones that can dictate your life, both physically and mentally, you're not even there.
Yeah.
And that's the thing. And that's the one thing about why the Wellness Way's approach is so unique, and why the Academy offers better practitioner training than any medical field out there.
Cool. So get tested. Are common warts caused from stress and nutritional deficiency? And how do you remove them naturally or make sure they don't come back?
Okay, now it's kind of fun. A wart is just an encapsulated virus. Let's start there.
Oh, okay.
It's an encapsulated virus. That's why if you ever notice, you can remove the wart, and what happens?
It goes away.
No, it comes back though.
Oh,
it goes away. You can
yep.
remove it. You can even cut it out. You can do things that way. But what happens is, if you see a person that suffers repeated warts, it's immune deficiency. It's like this. I get this question a lot, because obviously we were talking about college before. A lot of young ladies and stuff end up with type 2 herpes, and they have no joke. It's like going and they're like, okay, here we got and they have a breakout. When they have a breakout, when they're chronically stressed and their immune system comes deficient. But you can keep your immune system. Remember, people don't realize. People freak out about type 2 herpes. I don't have it. You're saying, but I just make that clear. And so people say, we're trying to defend it. No, I don't have it. You can look at my lab work. But the idea is this. But I don't care if you do or not. But here's the point. there's type 1, 2, 3, 4, 5, 6, and more, and they're all basically the same virus. It's just obviously if it attaches to your genitals, it's much more worrisome and stuff like that, and much more painful. But here's what happens: all those viruses are still brought out by immune deficiencies. So with those immune deficiencies being there, that's why you actually see breakouts even in college, because you know why? They're highly stressed, they're drinking like crazy, they're eating sugar like crazy, they're doing all the things that make their body stressed out, they're staying up late, especially women staying up late at night, which they should be in bed by 9 o'clock, and they're staying up till 11, 12. I don't understand it. I can honestly tell you, I do have a great education, I have a great background, but I never understood pulling an all-nighter and studying. I never did.
Yeah.
I always I couldn't. How can you study at 2 in the morning? Do you understand? It's like, so I just, so therefore I never had to worry about having some major immune deficiency. Now, here's what happens. There are great things that you can do even topically. Putting silver, putting apple cider vinegar topically. That's fantastic. You can even put certain herbs on your skin that work out really good. Uva ursa can go on your skin. It can help eliminate that one little wart. But internally, once again, with the viral load being elevated, they're just going to come back again.
Yeah.
So you can get a viral panel done to see what you got going on. But then here's what happens. Start studying the medicinal mushrooms. You know what I'm saying? I can honestly say I have a favorite myself. Someone asked me the other day, one of our docs asked me the other day, they said, Doc, do you take liquids every day? No, I only take one liquid every day. I actually take astragalus every day, because people know it's my favorite liquid herb. Now, my favorite thing to take actually is medicinal mushrooms that I do take every day.
Yeah.
There's certain things I do take. Every day, but I actually only take one of our liquids every day. And then I'll use. I know it sounds funny. I'll actually use our other herbs when, if I'm traveling and I want to sleep a little bit more, I want to do things like that, or I know that I'm with having this whole time change, that my timing's gonna be off. So I'm gonna take some herbs to actually help me sleep a little bit better, or a little bit of energy in the morning. I'll take some licorice in the morning to get me going and stuff like that.
What mushrooms do you take?
My favorite one by far is chaga. By far. Reishi's number 2, turkey tail's number 3, cordyceps number 4. If I was looking at the levels, I like those.
Yeah.
But also, you can also take them. We have one that's a medicinal mushroom mix. If you want to take a general thing, that's what my girls take every day. So they get a wide variety of the immune mushrooms. So then, therefore, that's why I don't worry about viruses and bacteria and things like that, because you're keeping your immune system supercharged. So when it does come in contact or is a little stressed, you're not crashing. Let's look at this. If you're older, think about this when it comes to shingles. People don't realize, if you let's say a young person at 30 years old has a herpes breakout, a genital herpes breakout, it's no different than an old person to have a shingles breakout. They just don't have the herpes 2.
Oh.
They have a different form of herpes, which is just called shingles.
Yeah.
That's it. And they break out when they're all stressed. Okay?
Cool. I want your opinion on vasectomies and tubule ligation.
My opinion?
Yes, your opinion.
I hate them both. All right? I hate them both. Okay?
What was that
They
bit?
said my opinion, so I've given my opinion. Now I'll explain a little bit. I get this question a lot. Can vasectomies lower testosterone levels? And there's a yes and no in that. It's like any damage you have to your body. There are individuals that will get a vasectomy and they don't recover well, and then once again they have a lower production of testosterone. There's guys that get snipped and recover really well, and they can maintain great testosterone levels. It all comes on how you recover from any trauma. You know what I'm saying? And because there are things that can cause permanent damage. Here, anybody have a scar? That's called permanent damage. You're going to repair, but you're still going to not do that. So I just don't want anybody cutting my nutsack and having that problem there. I'm sorry, you know what I'm saying?
Don't be a fool, rep tool.
That's right. It's like, I can't do it. I can't. I will never be snipped. I can't do it. I can't take the chance because I know individuals that have gotten snipped and their testosterone levels dropped. And people say, Doc, is the anecdotal? Yes. And this one thing I want to come back to all the experts and all the people that think double-blind studies are actually the way to go. Double-blind studies only work in the medical field when you can take something that forces somebody's body to work. See, for example, you get a sugar pill and you get a blood pressure medication. Yeah, but the blood pressure medication, you're taking everything so unilateral that everybody's body is different. Look at all the interns, male and female. Their bodies are very different. So trying to take something to make your body go normal can never work in a double-blind study. That's why it has to be anecdotal. Here's the criticism of experts when it comes to our clinical results that way. Well, it's all anecdotal because you can't take a PCOS person that has all the same diagnosis and get the same results with everything that you do the same. Yeah, because you dummies. You understand the fact that everybody's different.
Yep.
That's why that's why if an expert wants to debate me, they're going to lose. And I don't mean that negatively, but we are the best of the best at what we do. And so therefore, guess what? If you want to talk about specialties, I won't even open my mouth. Do you know why?
Why?
Because I don't think that way. It's not my specialty. I'm not going to open my mouth on something I don't know. If you're a brain surgeon, I'm going to keep my mouth shut and say, cool, I learned something from you. And if somebody needs a brain surgeon, great. You saying? But even the course of that brain surgery, there's destruction to the body. See, that's the saying. It's like, but that's the point of it going, when it's anecdotal, remember, it's individual care. That's why if you even looked at Sam's video, that doc talked about his individual care. And if somebody that is even suffering with the same thing that he's suffering with tries to replicate the procedures, the protocol, it won't work. So I always love this. Let's go in the natural realm, because the natural realm is trying to become experts, and they'll say, this happens a lot in the integrative world, especially because medicine has now taken over the integrative world, and even taken, and it always was a medical thing, just like functional medicine is always a thing. They'll talk about the thyroid protocol, and the woman writes a book, and I'm using the one girl, and she's great. I don't disagree that she helped herself, but I'm looking going, all right, Dr. Amy, you have this protocol for you. If you know anything about the human body, you could never say a protocol for everybody.
Yeah.
Well, doc, to produce T4, you need iodine, so everybody should take iodine. Okay, cool. How much for this woman, this woman, this woman, this woman, this woman? And on top of it, what happens every day when they have different emotions? See, so you can't have a double-blind clinical study because nobody's ever the same, and nobody's ever the same every day.
Yeah.
I actually get to speak on the medical field all the time, and I'm speaking to a bunch of pharmacists. And I actually set them up, and they don't realize, but they thought I was going to answer the way they wanted. And I said, listen, I said to the person, and I was speaking, and the person asked a question about levothyroxine and stuff, and I was giving my opinion and stuff. And I said, forget the medication. Let me do this. And I said, when you look at thyroid production, is the thyroid production the same? And we're talking about women at this time, or even men. Was the thyroid production the same for an individual every single day? So does the thyroid make the same amount of hormone every single day? And look at even the docs here going, no, that's not. Because let's say this, if you have a very calm day and a very low physical day, you'll have a certain amount you produce regardless. But now let's say you have a highly active, highly stressed day, which one needs more hormone? So then if you're giving them 25 milligrams of levothyroxine every day, some days you have too much, some days you might be exact, and some days you might have too little. So then how can you double-blind study that when everybody's day is even different? And they're like, and the one pharmacist says, well, we can't change your medication every day. And I said, I agree. But what if we get their thyroid back normal and they don't need that medication anymore? See, it's a perspective that they will never grasp. And I'm okay with that. I want them to be a specialist. You know why? Because if somebody has thyroid removed and you need a medication for the rest of your life, cool. I'll argue get away from levothyroxine and Synthroid. I'm not giving medical advice, but I'm just giving you an idea. Is that and go towards more Nature Throid or Armor and stuff and do it that way. And go talk to your medical professional and actually go argue with them to get it done. But the idea to think that you need the same amount of thyroid hormone every day is just not. You're looking at you can't step back and look at the trees and go, yeah, everybody does need the same thyroid medication every single day. Doesn't make any sense.
Cool. Can you please talk about eczema, what causes it, and what to do for it?
Okay, coming back to this again, eczema is nothing more than either an immune problem or a deficiency problem, and mainly a deficiency in vitamin A. Yes, D can be it that way. People say, doc, I've taken vitamin D, it changed my skin. That's because that vitamin D changed your immune system first and then supported your skin. So therefore, majority of eczema is actually an immune problem. A lot of the adult-based eczema is a lot of deficiencies. If you wonder why kids are getting so much skin conditions, man, Chad, remember when we were little, how many kids had allergies and how many kids actually had these conditions they had before? It was minimal compared to when we were, and as I said, and we're not 70 years old, we're only, late 40s. And here's the point. Think about this, is now eczema is so common, skin is so common in kids, and people say, well, doc, well, maybe they have that many deficiencies. Actually, no. The main reason why kids have eczema today is because they have triggered immune systems that they get from the day they're born. And I'll leave you guys at speculation when I'm talking about triggering the immune system and stuff. You saying?
Yep. Good.
So, yep.
Eczema. Can you explain more about your glandulars and when we should be taking them?
So let's step back here. I hope you never take one of our glandulars ever. And you say, Doc, well, you take them. You took them on your trip and took them over, and you take those every day and some of that. Yes, but here's why I say that. Brandon, when you're over at the house, every time, what do I give you every time you eat?
The digestible.
Yeah, but yeah, that's before you eat.
Apple cider vinegar.
He's totally messing it up. I give you your liverwurst.
Oh,
the organ meats.
well, you're talking about supplements. There's so
Yeah, no.
many. I mean, you do give me other,
Yeah.
like here, pass
Yeah, I
around
give you supplements,
The
okay, that's fine.
aloe, the apple
Yes.
cider vinegar. You gotta.
Remember we were in Reynolds? We were
Oh,
down
yeah,
in
okay.
Atlanta?
Yeah,
We
because
bought-
of course,
we
we did have delivery.
Yeah,
Yep, you're right.
But happens. Oh no, but remember then we did have the aloe. We had the
Yeah, we
apple
had all the
cider
other ones.
Yeah,
So I'm not
that's cool.
wrong.
No, you're not. But every time he comes over, I always give him organ meats to eat.
Yeah.
You say him, and here's the point: because if you eat them, you don't need to take them. Because remember, a glandular is nothing more than an organ in a what? In a capsule form.
Yep.
So that liverwurst, if we just put in a capsule, it's really no different than us eating it that way. So I'm hoping people never have to take one of our glandulars. You just need to eat them. Now I know people are grossed out because there's organ meats. Now you know what's really funny though? I will tell you something funny story. I won't mention any names, but we have patients that are vegetarian, but they'll take the capsules because they know they need them. Isn't that funny?
That is
It's like
funny.
they can't eat meat, but they think it's capsule. I said, do you understand? If you just open the capsule, you eat meat. You understand? But they see the massive health benefit from it that way. Because you know what's really funny? If you look at vegetarians, you look at vegans, stuff like that, they always have to supplement with what vitamin? B vitamins. And your greatest form of B vitamins still come from your organ meats. By far. It's dominating your Bs and stuff. So that's why. I will take my male glandular. I'll take the blood sugar glandular because I do like the pancreas and duodenum and stuff that are in there. Because I said you got to keep your blood sugar really well. So I encourage people to do is if you don't eat them, you have to take them. I hope you never have to take them. I hope you don't. I hope you just get the lifestyle. See, if you talk about even like, I know I'm referencing Sam's video a bunch today, but the guy had to change his lifestyle because if he really took a glandular and still drank all his beer like crazy, having an allergy, could it help some? Yes, but you can't out supplement. You can't outdo a bad lifestyle. You can't. In the medical field, and all the specialists have literally lied to you and said you can. So, yep.
I thought we were supposed to eat bull testicle. When were we supposed to do that? I thought you said we were gonna get some in.
They're on back order.
Oh, are they?
That's why we've had, and we have bull testicle in our male glandular, but
Exactly.
what happens is we're on back order. So, yeah.
Gotta wait for that.
Yep.
Okay, on the topic of foods, if you could choose a few foods to add to your diet, if you're new to the health thing, what would it be?
Yeah, well, I'll go back to when Brandon traveled with us down to Atlanta. And it was kind of great because we went to Whole Foods. Remember, we got off plane. Not a joke. This was normal for our lifestyle. We got off the plane. We went right to Whole Foods.
Yep.
Right to Whole Foods. And we looked for, because here's some of my rules when it comes to our family. Is number one, you got to have a tablespoon of sauerkraut every day.
Oh, yeah. Yep.
And the kids. So we grabbed a tub of sauerkraut. We grabbed apple cider vinegar. And we grabbed aloe. Okay? I have my favorite one. I mean, that one that we buy at Costco, the big ones. Is awesome.
Yeah.
I forgot the name of it.
I don't know the
Show
name of it either.
But and remember, let me say this: I have no ties to the sauerkraut company. It's funny because I get so many emails, and I watch people like if I talk about a product, like I get some reimbursement from them. No, I just like here. Watch this. I love Bragg's apple cider vinegar, and Bragg's doesn't even know who I am.
Yeah.
And I've sold millions and millions of their bottles of vinegar, and just from my advice to giving people millions, I guarantee I probably in 23 years of practice, probably $100 million bottles of apple cider vinegar have been sold just because of our reach and stuff like that. But I don't have any ties to them. I don't get $1 a bottle and things like that people do. But I use this is like we got apple cider vinegar.
Yep.
We had aloe and we had sauerkraut. If people just took those three things and add them into their diet, and like I said, add them into just a normal health regimen, your life would be better.
Yeah.
You would be less inflamed. Okay? Is it more than that? Absolutely. But those three foods are very cheap. Then you throw organ meats in there.
Yeah.
Do you understand? I always love this. I'm being nice about this, so understand when I say this. Poor people come to me and say, Doc, I can't afford to eat healthy. No, what you're saying is you can't take your Oreo cookies and buy the organic ones because the organic ones are $10 a cookie.
Yeah, it's expensive.
I get it. So what they want to say is they want to replace all their stuff and they're and if you can afford a $10 cookie, buy it. I buy the $10 cookie.
Yeah, for sure.
I don't mind doing it. That's why when you go to Whole Foods, it's called whole paycheck. Okay.
That's good.
It's true, but you want something that's really cheap even at Whole Foods? Sauerkraut, apple cider vinegar, saying this.
Yeah.
No one ever goes broke on healthy foods. Everybody goes broke on converting their bad
Substituting.
foods to the healthier version. You understand?
That makes
Here,
sense.
watch this. Make a healthy cupcake compared to a crappy one. It's much more expensive.
Oh, yeah.
It's much more expensive.
Flowers are crazy.
It is. So I say, well, just get rid of that. Well, I don't want to. Then don't tell me that your foods are expensive. What you're saying is you want to replace your same emotional eating with a healthier version, which I'm cool with. I do it. I do it. Heck, now I want to go to Happy Belly's after this.
Yeah, I
and
know,
go down
that
and get a
sounds so
cupcake.
good. I
I'm
might
gonna
have
cheese
to
it.
for quarter anyway.
Oh, let's do that. Let's go there. Okay.
Cool. But if you do eat those three things, sauerkraut and everything, it could be a crappy situation for a little bit.
And what he means is your bowels will change nicely.
Can
will.
people get off their medications under your care?
Oh, that's a loaded question. Okay, let me say this. My practitioners from the academy, my doctors, my chiropractors, my nurses, everything, I instruct them, which they do very well, is you never give medical advice. Because that's not, remember, and I know I'm going to say this to the last 10%. The Wellness Way doesn't give medical advice. Well, doc, but you have NPs, you have a pharmacy, yeah, guess what happens? They still don't give medical advice. The result of our advice allows their body function to come back, and then their need for medication actually, and I will say the high majority of them end up getting off their medication based on the advice of their doctors. Let me give you an example that happens all the time. Blood pressure medication is very common for people. Insulin is very common for people. So therefore, if somebody adds apple cider vinegar and aloe and sauerkraut to their diet, people that have blood sugar problems start seeing some change. So they see less of a need for insulin. We don't tell them to do their insulin, but here's what happens. If they still take the same amount of insulin they were taking before, they go hypo on their blood sugar, and then they have some other major symptoms.
Yeah.
So then they'll even call and say, doc, what do we do? I say, listen, go to your doctor and tell them what you're going through, and they will change your insulin dosage that way. To the point that people have weaned it off, but it came from their medical professional to tell them that. Now, the nice thing is this, we do have certain medical people that do work in our clinics. They do the Wellness Way care, but for example, I've done this before, say, hey, listen, go down by Nicole and she'll help you alter your medication that way because she has a legal degree to be able to do that,
Yep.
okay? But the idea is this, is our job has been very successful at getting people off of medications, but never actually it's been our advice to get off them.
Cool.
So, but sorry, your blood pressure goes back to normal. You take blood pressure medication, it goes low and it can cause harm.
Okay, a couple of questions on colonoscopies. So one of them, colonoscopy for guys over 50, what do you think? And then the other one is, do you recommend colonoscopies if there's a family history of colon cancer?
No and no.
Cool.
See, they put these procedures that actually can even cause damage. Do you understand? There's a lot of punctures that happen for colonoscopies. Do you understand? Now, am I against colonoscopies? No. But actually have a justified reason besides of age. You know, what they really should say is this. Here's what doctors should really say, and I'm okay with this. I'm okay if a doctor says this. Listen, I've been your doctor for 30 years. I don't know how to take care of your intestine. So therefore, you probably have some bad intestinal problems because I'm just going to medicate you and help you palliate and manage your disease conditions. So you probably have a really bad colon. So we should actually look at your colon. That'd be honest. Do you understand? Because here, they don't do anything to teach you how to take care of your guts. So therefore, your guts are a mess. So therefore, people have a lot of problems that way. But to standardly do it at 50 years old based on age doesn't make any sense.
Yeah.
You understand? Because here's why. Now, if a person this has happened, I've had a person reach out and say, Doc, I'm pooping blood. Well, you either have an ulcer, could have cancer, could have everything. Get one done. But here's also what happens. Do you understand that the colonoscopy is made mainly for large intestine? It only goes up a couple feet. You understand? People think that you're going up all 20 some feet. Doc, my colon's clean. What part? You have 20 some feet. Do they stick 20 some feet of cable up your butt? No, you think I'm joking? That's how I talk to patients. Going, because just having a conversation with them. Because otherwise they're confused by docs. I'm like, well, doc, what do you mean? Well, they only go up so many feet. How far do they go up? And they go back, call the doc, say, well, we only go up about 3 feet and stuff, trying to get your large intestine. What about my small intestine? Well, we don't get that far up there. Well, I have 20 some feet of it. What if I have problems there?
Yeah.
You understand? See, they're totally missing the boat, and they're misleading people like they're actually checking all their intestinal tract. So, yep.
Cool. Why is medical care and politics so connected?
Money. The last 2 years have showed us it's all about money. Do you understand? If it was about health, our president wouldn't have got tested positive for COVID again.
Oh, jeez.
Do you understand?
Yeah.
It's just pure money. See, it's quite interesting. That's why people say, Doc, why are you so heavily involved in politics? Because I'm fighting it. I'm fighting it for all you guys. Mm-hmm. You know what? Why most people were sitting around being compliant, I didn't stop fighting.
No.
I never did. Because you know why? Because I wanted to fight for my girls and your girls and our kids that way, because I just believe, and here, I was over in Ireland. They have socialized medicine. I was in England. They have socialized medicine. And I asked them this question, and everybody, regardless of what insurance you have, regardless of what your political views are, there's not one person that ever answers this question wrong. And my question is very simple. Who should make the healthcare decisions for you and your family? You or the government? You understand? And believe it or not, when you give government control of your healthcare, guess what happens? They will tell you what to do. But you do not realize when Obamacare came out, it says if you don't follow medical care, they can drop you. So if you said, I don't want to give my child the Hep B vaccine, which is actually made for prostitutes and IV drug users, or I don't want to give my child the COVID vaccine, they could actually yank your insurance. Jeez. If it's government control. See, so get government out of stuff.
Yeah.
You see him? You know, government sucks at almost everything it does. Yes, teachers, you guys suck at it. You understand? Now people say, is it bad teachers? Yeah, but there's also just good teachers are still what? Are still in a system that sucks for them. So the good teachers have to actually be bad teachers in order to live within the system. Isn't that crazy?
Yeah, that is crazy.
Now, I'm not saying that person's a bad person. I'm saying you are in a profession. That's why people say, Doc, why didn't you ever go get a medical degree? Because then I had to follow their rules, and I would be, and that's why, no joke, I actually have had direct conversations with doctors that didn't believe about all the COVID stuff, but still did it. I'm like, you're a bad person. But see what it is? Oh, I got to do it for my job. I got to do this for it. See, I would never put any of my employees in that situation.
Yeah.
To make them go against what they truly believe. You understand? In any aspect. Politics, religion, anything that way. You understand? Because I'm sitting there going, I love this, and I mean this sincerely. I watched medical doctors go, well, I got to get the shot. If I don't, I'll lose my job. Do you believe in it? No. You understand? You give it out. Well, I have to. I'll lose my job. I'm like, really?
Time for a new job.
Sorry. I mean this sincerely. I don't want to be surrounded with people like that. And I mean it more sincerely. I don't want to be surrounded with men like that. Because to me, that's not a real man. Revolution started when men stood up. See what I'm saying? It's really funny. I was over in Ireland, one of the most compliant states, and I spoke about this stuff.
Yeah.
And I'm like going, but it was interesting because there was some people that were like pushing back. And it's quite interesting because remember, a revolution comes when you stop being compliant. You understand? And so people are like, you just got to find a topic, something that really pushes people that way. And I think that's why, once again, you start pushing shots with kids this way, you're going to see a little bit more revolted that way. So, yep.
How do you treat an infection in the gut? And I do have another part. There is someone that says, how do you recommend to fix gut health? They've been suffering for IBS, so it's kind of two parts.
Yep. Well, remember, let's start with, because two things. It's kind of the same question.
Yep.
Irritable bowel syndrome. Find the irritants. Do you understand? And just like you saw the wonderful man that did that testimonial video, he was irritated by tomatoes. I'm irritated by eggs. Do you understand? I'm irritated by other things that way. So what happens is find those irritations. Now, irritation also could be in bacteria or a virus. So therefore, when you get a stool test done, the cool thing about getting stool tests done, if you do have certain bacteria that are overgrown or a parasite that way, they actually legitimately test how to actually take care of it. They'll even give you a panel what you do for drugs and stuff. It's like, that's why you see a lot of antifungals used a lot, or even on labs that way. So what you can do is you can actually get those things tested to see exactly what you need. But the idea is this: start by actually finding the irritants, and then, but just by removing the irritants, you need to do the things to heal the bowel. That's why eating certain things are so important. That's one of the reasons why I do love sauerkraut, because it has both soluble and insoluble fiber. It's a great way to start.
Perfect. I see a question that just came in. It was about aloe here.
Yep.
Please explain. Is there some resource that states aloe is not safe? I'm assuming it's the brand that makes it unsafe.
No, here, let's always go back to this. Here, just like I said with medications, there's no food that can be generalized for everybody. Do you understand? And so that's why I tell people allergies trump everything. Can a person be allergic to aloe? Yes. Have I personally seen somebody? No. Have I had doctors have people that react to it? Yes. Do you see what I'm saying? And so therefore, when you look at anything that can be allergic to anything, remember, you can be allergic to a dog, a cat, a tree. You understand? And I always love this one. Here's one thing I always love. People get tested for allergies of all the antibodies, even IgG, IgA, IgE. And I love this. I always love this one. People say, well, doc, you know, I've never eaten this food, I'm allergic to it. And I'll look at their test that they had from an allergist, I'll say, have you ever ate a dog? Well, no, then how are you allergic to a dog? Do you understand? I love these arguments I get, oh, it's the protein your immune system responds to. Or I'm like, Doc, I'm allergic to a popple tree. I'm allergic to this. Well, did you ever eat a popple tree? Well, no. See, so that's what people realize. They think that they eat something to be allergic to it. No, it's how, remember, allergies are immune response. And something triggered your immune response to be sensitive to that way. So, yeah.
Very cool.
Yep.
Well, is there any mail-in food allergy tests that you can recommend?
I don't like them much at all because it's a very minimal testing venue that way. I still believe you should get a blood draw done. Immunolabs does do a finger prick one. It's just not extensive. In my career, I will never do a blood test unless it's actually a blood draw. Now, you can still do a finger prick. There's a finger prick one that Immunolabs has that it's just not as extensive, but it's very accurate, things like that. So you could do that one. I just say go to a doctor and get the blood draw and get the big panel done.
Yeah.
So,
and we have an allergy panel that we can do.
So Immunolabs does have a finger stick one. You can call. You can buy it from the website. You can call it. I always tell people this: go to a local office and get it that way. You know what I'm saying? Get it because you need some advice after it.
Cool. What are your 3 best tips for getting candida back in balance?
Okay. Now I always love this. I always love the anti-candida diet or the everybody's so big into candida. Now, you can see on a stool test where it's overgrown.
Yeah.
But you know what happens if you got rid of all your candida? You couldn't digest food. Your immune system would be weak because candida is a normal flora. So what people do is they confuse it because it's so overgrown because people eat so much sugar. So number one, stop your sugar. Stop your sugar. You're saying get rid of it. You're saying because you're just going to feed it. It's going to grow. But more importantly, and this is what's missed, is if you look at candida and where the majority of our microbial fermentation is supposed to happen. All right, docs, my interns, where is most of the fermentation in the gut supposed to happen? Large intestine, right? Large intestine. Okay, they got it right. See, it's called large intestine. You know why? Because in there's a lot of fermentation process that happens. So therefore it expands. Now when it expands, it gets large. Well, it's meant to be expansive. If you get fermentation in the small intestine, they even have a term for that. Small intestinal bacterial overgrowth, SIBO. And that's why when people go, I always love this. So if this ever happens, if you're at a holiday, so let's say you're having a party this weekend.
Yep.
Okay? And you eat good food. And all of a sudden, I always love this. You always have that uncle that stands up and he pushes out belly and says, oh, I'm so full. Look at my belly sticking out. I'm like, dude, your intestinal tract is 25 feet long. You didn't eat 25 feet of food. But what you did do is you ate some things you shouldn't have. And then you start some of that fermentation process early. And then just like a fermentation process, there's bubbles and there's gas and there's expansion. And that's why you see the belly distension. So, yep.
Cool. All right. Good morning. I recently had a complete hysterectomy.
Oh.
I was plunged into menopause at age 47. My mom recently had surgery for breast cancer and biopsy revealed cancer cells in my left ovary. My gynecologist is hesitant to put me on HRTs even though my symptoms are wide and varied. Any advice on natural foods for the hot flashes, mood swings, vaginal dryness?
Yeah, I mean, when you get a full hysterectomy, let me say this very clearly. You need some form of replacement. And I would encourage a person to do a little bit more of a bioidentical approach that way. And it can be, you just gotta get tested every 3 months to make sure you're not getting your levels too high or even too low still. But then once again, start here. Ladies, if you're in menopause, you need to make sure your adrenals are doing really well because your adrenals produce a lot of the androgens that now convert into the sex hormones. Now, once again, your estrogens are sex hormones, but all of a sudden, if you produce testosterone by your adrenals or androstenedione by your adrenals, then it converts in your estrogens that way. And that's why I will tell you this. I can honestly tell you, my favorite herb for menopausal women, now, once again, you can't blanket it for everybody, so once again, but I will tell you this. My favorite herb for women that, especially if they're suffering and I know they're already deficient, is actually licorice. I really like it, you Sam, because you know why? Because once again, it will start to feed that adrenals to help produce some of the anabolic hormones needed that they see some change. Now, if you had a full hysterectomy, you still need some replacement. So you can get some drops that will work really well. You can get a cream that will, just make sure it's bioidentical. Don't do HRT. You understand? Now, the reason why most doctors now are hesitant to do HRT if you have any form of any hormonal problem that could relate to cancer is because of a major study that they realized back in the early 2000s they caused more cancer by giving HRT than they ever did help women. It was a big worldwide study. And that's why even doctors are very scared because they don't see. And that's the thing, ladies, they don't know what to do with you anymore. They don't. That's why I've always told all my practitioners and doctors, you know, women, that's why they're packed at my seminars. They're so sick and suffering today. We need more people to do what we're doing. We don't have enough. I can honestly tell you, there's not enough chiropractors, there's not enough nurses, not enough doctors out there to do what we do. That's why I had to start the academy. So, cool.
Hey doc, my 15-year-old son is diagnosed with high-functioning autism from the age of 2.5. Our new psychologist is suggesting Ritalin for him to focus more. We would like to know what you would suggest that would be more of a natural aid. Thank you in advance for your help.
Yeah. So obviously, I can relate to a little bit of this because that's what they probably said about me when I was younger. So let's do this. The brain activity is very stimulated. Number one, you have to start by removing all of his sugar. You really do. You have to, because it's such a stimulant to the brain. It really is. So I know it's difficult, especially with a young child that way, but it's very difficult. Second of all, I will tell you this. Now remember, you gotta make sure you're not allergic to this, but I'm a huge fan, and I do this myself. So people say, well, doc, herbs. Well, now let's go back here. I'm a very big fan of cod liver oil with kids in their brain. If you notice, what did I order that you'll see down in the kitchen down there? The true cod livers.
Oh, yep.
It's one of the healthiest organ meats to eat. So you will see a very amazing calming effect to their brain by adding some of that. And you also get regeneration. Remember, the brain does regenerate. I'm a big fan of using things like California poppy for that child's brain. I'm a very big fan of using like Lacuna seed because it actually helps with amazing dopamine production for them. Now, once again, I'd rather see them also get their immune stimulants checked, in fact, their triggers, because the immune system does produce a lot of glutamate that can be very stimulatory. Most of your high functioning, most of your kids on autism have very bad immune issues, and the immune system produces a lot of glutamate, which is the most excitatory neurotransmitter there is. That's why if you ever notice a child that gets triggered immune-wise has a very bad psychiatric episode. I experienced that myself still to this day. And but I would say this, is that high functioning kid, his brain will always move at a very high pace. And he'll be able to think and process faster than most people. That's what I suffer from. That's why people say, Doc, you make snap decisions. I just process much faster than everybody else. That's why when I was young, I believe I could figure out things that other people couldn't. And my brain's always going 100 miles an hour to this day.
Yep.
So people that know me personally know that.
Oh, yeah.
So, yep.
Quick question. Do you have any thoughts or recommendations on minimizing cellulite? I have always been very athletic and fit, also mindful of my diet, but just started noticing since being in my 50s.
Yep.
Any advice you would have on this matter would be greatly appreciated.
Yeah, there's a little bit of hormone estrogen deficiencies there, but also you're going to find this funny, vitamin A, and there's a little bit of liver issue. Now, it's going to sound funny. One thing that is really good for cellulite, and it's going to drive everybody nuts when I say this, caffeine. Caffeine's known to help it. It really is. It's because remember, it also helps the liver. That's why if you ever notice, one thing that is very good for cellulite is actually coffee enemas. And so I tell ladies, I'm like, coffee enemas are fantastic for you as you get older because then now you get major glutathione production. But then remember, make sure to get towards your organ meats because you get massive amount of vitamin A that actually is really good for your skin and really good for actually helping that cellulite metabolize and stuff. So
What is cellulite?
it's here to give you an example so all guys understand it. It's like, look at a golf ball. See all those pock marks?
Yeah.
You see that in ladies' legs or things like that. So it's actually a picture the golf ball marks on, that obesity and stuff like that. So
Perfect.
yeah, that's an analogy I always give people, and then every time you look at a golf ball, they look at it different now. So
Okay. I once heard you say in a video that icing after an injury can actually further the damage. I asked a doctor in Bloomington Wellness Way, and he explained it well.
Good.
But there has been a question burning in my brain. What about ice baths? I was in college sports, and I was required to ice bath after lifting, and I was shocked at how not sore I was the next day. So I'm really curious to hear what you'd say about this.
I love that question. I'm a huge fan of cold ice baths, but let me explain. So, because what they're doing right now, if they did ice baths right after their athletic performance, they cause damage themselves. Let me explain. So therefore, this first thing I do in the morning, I did this morning, is even when I shower. Guys, remember, never end on a hot shower. Always end on a cold shower, okay? But like this morning, don't shower every day. I know it sounds funny. Unless you work out, you should shower every day. But the idea is this. I know it's kind of funny because then people say I stink. Well, then you got to do it. But you lose a lot of oils on your skin, things like that, and you cause more high. Do you understand? If you shower every day, you actually need to take more things because you need more oils, you need more vitamin A, you need more everything because you're actually taking some of that from the surface of your skin, so your body has to produce it.
Is it only if you use soap, or can you just rinse off with water?
No, actually, soap, you need it more.
Yeah.
Even healthy soap, you really do, because you're emulsifying some of your fats. This way, what do you think soap does? It emulsifies fats. So you'll actually reduce some of your fats on your skin and protective layer. So that's why you need to actually keep the inside doing really well. And that's why you need to put another fat back on your skin. That's why you put oils like coconut oil on your skin. That way it's to help restore some stuff you even lost from using healthy soap. So therefore, here's what happens. When you actually look at cold bath, is much different than talking about having an injury and actually icing it, all right? So let's do this. Let's say that you were an athlete and you sprained your ankle. Okay, here's what happens. There's cartilage, there's connective tissue, there might be bone damage, there could be some ligament damage. So I got a question for you. Your body's God-given natural response to know that there's a problem there, in order to repair it, what does it have to do? What does it have to do, guys? It has to create, yeah, see, I ever said it, create inflammation. And the medical one-tree specialized thinking is, I gotta reduce that inflammation because pain and symptoms. I'm like going, and if you do that, then you actually cause vasoconstriction, you cause all of the immune system that's supposed to clear all that dead tissue, you actually stop the repair process, the proteins, everything coming down there to repair and rebuild because it's sore and painful. You understand?
Yep.
And you also cause a numbing sensation because ice travels faster up a nerve than heat does. You cause a numbing sensation to where people now will say, well, I can walk on it because it feels better. And they actually cause more damage to already a damaged joint.
Oh.
And so therefore, when people do athletics, you injure it, you never want to ice it.
Shoot.
You never. Because you are stopping the normal natural process of the body to heal, repair, regenerate, bring the immune system down. If you leave dead tissue in an area, it will actually basically rot on the inside, become gangrenous and stuff. So that's why when people twist their ankle, I'm like, and they're like, rice it, rest, ice, compress, elevate. That's been disproven so much. Actually, no, don't. Throw it in a heat bucket. Actually, keep your limb down. Don't elevate it. Don't compress it. Let it swell up. Well, doc, it's gonna hurt. Yep. And here, watch this. You need to take some pain medication to get through the pain, take it. But let it repair. You understand? Why would you ever slow the healing process down? So now, when you actually jump into an ice bath, believe it or not, your body goes into a fight or flight anabolic response. It's a good thing. It's actually, you're challenging your body. So therefore, ladies, if you want to actually reduce cellulite, if you want to actually reduce fat, increase your thyroid, take a cold shower every morning. Because you know why? You start lowering your temperature, your thyroid goes, I gotta kick in, I gotta kick in, I gotta kick in. You understand? So, and what it does, and that's why it's really funny. People say, doc, you'll actually, even in January, you'll walk outside barefoot and try to stand outside and get as cold as possible. Yeah, I would do. I do that every morning and stuff like that. You ever notice how crisp and awake you are after that?
Oh, yeah.
You're very attentive. You understand? Hormone levels are running like crazy. Your thyroid's kicking in like crazy. Metabolically, you want something good for your metabolism? Cold. Get cold. So, but don't do it to reduce blood flow to an area that's trying to repair. So you athletes, you go beat up your body like crazy. You run too much. You hurt your joints, and you jump in. You're less sore. I don't want you to be less sore. I want you to be more sore because your body's saying, "Stay off this darn ankle. Stop bending this joint. You're hurting me." Do you understand?
Yeah.
So you numb the nerve endings so you don't feel it. Oh, I feel less pain. I'm like, that's not a good thing. You understand? That's not a good thing at all. So it just makes no sense when it comes to the human body.
Cool. My grandma recently went to the doctor and found that her carotid artery is about 60% blocked.
Yep.
She was also worried because her cholesterol is high. I tried to explain to her the Wellness Way approach and when it comes to cholesterol, but I'm not sure she is completely convinced yet. As of now, she refused to take the statin drugs her doctor prescribed, but she just doesn't know what to do to prevent the artery from getting more blocked and how she can decrease her risk of the stroke. The doctor basically just told her to take the drug, come back in a year, and see how her condition has improved or worsened. Curious what your thoughts are for what she can do to support her body and prevent the artery from becoming more blocked.
Well, it starts with this. First of all, you got to get all your systemic inflammation down. The reason why those arteries are blocked and damaged in the first place is because of chronic inflammation. I was watching a doctor the other day because I download some videos and I always like to see what these PhDs are saying. And they're like going, cholesterol is a bad thing. It's like, no. And on the flip side, you have natural professions saying cholesterol is not bad, not bad at all. Well, that's not true either because there is some cholesterol packing that does happen in the heart. And so there's more of an answer in the middle that way. All right. And you got to remember, so by them lowering their cholesterol, they're not really slowing down the artery from being there because there's more things that. First of all, chronic inflammation, get it down. There's so many factors that contribute to that. Now, also doing this, also having some regenerative aspect that way is very important. Now, if you ever look at one thing that's very important for your arteries is vitamin K. And guess where you get that from? Fermented foods, sauerkraut, and things like that. So when you start implementing vitamin K into your diet that way, it's very good for arterials. I'm a person that loves things like Neo 40 because that helps with nitric oxide production, which really helps you on your vessel lining, your regeneration. There's great documentation of arteries being unclogged and things like that. I also I believe it's going to sound funny, if a person has a very majorly clotted arteries, I do like IV nutrition. I do like IVs. I really do. Because you can do certain factors to grab that out that you can do an IV that are pretty phenomenal and stuff. You can actually just do it even a Myers cocktail and it does a wonderful job of starting to change those arteries. So, but without the chronic inflammation coming down, it's coming back anyways.
Cool.
Okay.
Any advice on avoiding a root canal surgery and avoiding an antibiotic when said tooth is infected?
No one know. Root canals are so tough, okay? Also, you can try to use as much silver as possible on the tooth directly that way. I'm not a fan of root canals, but I can see them being done. But on the flip side, I also can see them being done. It's like this. Some people get root canals and they get very infected. And that's why they say root canals have a very correlation with cancer. Well, okay, I know what they're saying. Some root canals get infected. That infection is very hard for the immune system to get in there. So therefore, it's high chronic inflammation. And that's why you see bleeding gums and you see heart disease. And that's why they correlate heart disease and bleeding gums and all the great things that way. Yes, I agree with all that, 100%. But I also know people that have root canals that never get them infected, all right? If you take oral health, you have less chance of getting all infected that way. That's why I'm very big in hydrogen peroxide in the mouth. I actually love silver in the mouth. Honestly, silver is fantastic. Silver is really still the best form of like an antibiotic there really is. That and garlic are fantastic, okay? But the idea is that's why silver should be done on a regular basis. And then on top of it, if you do end up with a tooth infection, you may end up on an antibiotic. You really will. And if you do have a very bad infected tooth that has root canals that way, you may have to get it pulled out and stuff. But as a standard, I don't believe in you should always have them pulled out because I've actually had people that have actually had, and I'm speaking from a person that had a root canal and had to have their tooth removed. You're saying because it got infected, and there was nothing I was doing, and I already knew all the stuff what to do as far as to do the best preventative stuff that way, and still got infected. So I'm a person that's saying it can't happen. I'm personal myself, and yes, and if you leave the tooth there, that constant reinfection, even inside tooth that immune system never get to. So
You love the dentist, don't you?
Oh, I personally go to the dentist every 3 months, just because Linda loves me because I go there every 3 months, get them cleaned and ozone because I love ozone. Once again, a very good factor for your teeth. So I get it done, and but I do that because teeth, man. If there's one part I thank God for drugs is actually tooth pain or care. You know what I'm saying? Can you imagine getting your teeth drilled on without drugs? I'm sorry, the over natural people, and I make fun of both of them, but the over natural people that say I'll never take a drug, I'll just go and get my tooth drilled. Well, then you're more of a person than I am, man. I'm like, drug me up when it comes to the dentist.
Can a person who had a C-section done on their first pregnancy, can they have a vaginal birth on their second?
Yeah, they can.
Okay.
Now, here's what happens. If you stay with the same doctors you had before that led you to bad hormonal health and all the problems you're in the first place, no. If you do something totally different and actually get to a wellness way doctor who knows how to take care of you, knows how to take care of your hormones, knows how to actually make sure that you're all stressed out, makes your inflammation down, then yes.
Perfect. Thoughts on OCD?
Yes, I suffer from it every day. So, thoughts on it?
Anything bad? Probably not. Just personality.
Do you know what's really funny? I'm going to cover this at one of our shows. There was a major research article just came out that showed antidepressants don't do anything. Don't do anything. And it's like, and I know people are so mentally addicted to them. 65 million Americans are taking antidepressants every single day. It's over 25% of our population. We look at some psychiatric conditions that we never teach people how to deal with stuff that way. Guys, no joke, for people that know me I'm very obsessive compulsive. I'm very laser focused. I'm very, my brain goes 100 miles an hour and stuff. And if I didn't do what I did and know how to control it, I could be a mess. You know what I'm saying? I get it. You can obsess about bad things. You really can. You just gotta, do you understand most psychiatric issues, and this is gonna get me in trouble, most psychiatric issues are people lack purpose in their life. They lack purpose.
Yeah.
You ever they go to work, they have this, and I'm like, they have no purpose in their job, they have no purpose in their marriage, they have no purpose in their kids that way, and I'm sorry, you ask them and say, what are you living for? And stuff like that. It's just a routine. Sorry, you lack purpose. I'd be depressed too.
I feel like a lot of times you told me that you have those conversations with your patients half the time, just like talking to them about their life and guiding them, right?
Yeah. Yeah, actually, it's funny. Man, you're asking me a lot of things that get me in trouble today.
Sorry.
I'm like,
sorry, everybody.
I see a lot of depression in people that lack purpose, and they create a lot of mental stuff in their head of problems and stuff like that. I see a lot in the Christian community. They're always bitching about something, you know what I'm saying, and blaming Satan for everything and stuff. And it's like, they create problems. They really do. And I'm sitting there going, what are you getting up for every day? You know what I'm saying? And I know that it's critical, but I'm like going, remember, as a doc, I got to find what's stressing out.
Yep.
I'm like going, and they're depressed. Well, what are you depressed about? Well, I just hate my life. Well, what do you do in your life? Well, nothing. Sorry, watching the Packers every Sunday doesn't give you a purpose and stuff. I mean, that's why when people say, Doc, you grind 7 days a week. Yeah, I do. I have a purpose, you understand? And nice thing is, our purpose is extended to people over the world. Yep. And people say, well, I don't sound like I'm sympathetic. People that go through depression. I am. I'm very sympathetic. I've seen very depressed people and stuff. And I'll just ask them some things. And so people that worry about stuff all the time. And if my OCD would be focused on worry, I'd probably be depressed too.
Yeah.
But it's really funny. It's like I focus on the good things. I focus on what I can control. If and that's part of being healthy. People are like, well, there's so much bad stuff in the world. Well, here's what I focus on. That means there's a lot of opportunity.
Yep.
You understand? It's a lot of opportunity. If there's something bad, if there's a lot of sick people, don't be sad and focus on so many sick people. Come up with a solution. You understand? It's like, and so that's what I focus on. And could I be like everybody else? Oh, life is bad and this. No, that's what pastors teach you so they can have you come back to your church and donate all the time.
You're getting yourself in trouble.
I know.
That's on you. I did not set you up for those ones.
That was true. It's like, yeah.
No, yeah. Okay. Do ice showers help when you're already in fight or flight?
Yes, they do.
Okay.
They really do.
Cool.
So I would definitely do that.
I think we're down to our last question here. I have a rare vestibular syndrome, superior canal dehiscence.
Yep.
Is that how you say it? Syndrome?
Yep. That's rare.
Yeah.
That's very rare.
It causes major dizziness, which causes a lot of fatigue. I also get migraines, which cause cognitive impairment. I had to take antibiotics for acquiring bladder infection, which was staph. I'm now craving sugar. I'm taking a biofilm disruptor, which I feel has helped more than the antibiotics. I always try and do the natural things first, and I've treated for the first 2 weeks with D-mannose, but I couldn't get rid of it. I'm looking for ways to support my kidneys, liver, spleen, pancreas. Sorry for the rant.
No. And let's go back. That person needs a stool test. The reason why there's been chronic, and that's why you end up in antibiotics, chronic infections. That is a chronic infective issue right there that person's going through and stuff. And look at that way. So they have those immune triggers, but it's constant infections that are reoccurring. So probably immune deficient, has some overgrowth that way, needs to get an infection taken care of. So, right.
Last question here.
I got a couple here too.
Oh, go ahead.
So Dr. Patrick, I'm curious regarding your system on priorities. I have listened to everything I could find on your talks regarding priorities, including your teachings on Facebook. Do you have a book that teaches the system? How do you work on your priorities throughout the week on a daily basis? I'm confused on how you know a daily basis what to work on as business and work takes up the majority of our daily lives. Thanks for taking time to answer. Love that question. That's actually what we're kind of talking about.
Yeah, literally.
So I will say this for the person that asked this way, is when it comes to priorities are nothing more than what you want in your life. And so idea is this, and I tell people, just for me, I'm gonna have 6 of them, okay? I actually made one of my doctors upset with me, and that's probably why they ended up quitting one time and stuff, because she told me she had 17 priorities. And my response was, your life must suck. You understand? And I'm like going, because there's not enough time in a day to have 17 priorities.
Yeah.
There's not. And so my first thing to understand priorities for people is, number 1, you gotta know what you want in your life, okay? And write it down. Number 2, if you can't do this, you'll never succeed in life. And I'm gonna share a secret. And it's gonna be, and this is not a joke. And us men will have less of a problem with this than women. A lot less problem. It's funny because here's what happens. Unless you have the ability to say no, you'll never succeed in life. You'll never succeed in life. Because by nature, what will happen, women say they're more agreeable, so they say yes to more things than guys ever do. See, they'll call a guy selfish. People will look at me sometimes and be like, well, you're selfish, because no, I'm not. I have my 6 things in my life. Here, watch this. Now watch this. I used this example the other day. And I was talking to one of my docs that is really just doing wonderful, young doc, doing things great. And I said to him, and I said to him, then I talked to, and I did this with 2 people. One was a young lady, one was a young man, but I would talk to the young man first that way. And I said to him, here's the one thing that's kind of funny. I said, when you marry my daughter, we'll keep it quiet though.
Yeah.
But my daughter got engaged when we were in Atlanta. Congratulations, Faith and Devin. But I said, listen, you know what something is this? Don't worry about coming back for holidays. Because when you get married to my daughter, you now are a family. And I mean this sincerely. And I was talking to another young lady who was recently married and had a child. I said, listen to me a question. I said, now that you have a family and you have a child and your husband, everything that way, I said, what's Christmas and stuff like for you? And this is not a joke, and I mean this sincerely. Do you understand the majority of women I talk to say, oh my goodness, got to pack up the kid? So I'm like, then why do you do it?
Yeah.
Well, I want to go see family. Well, just one day is so special that you got to get together. Mm-hmm. If you don't prioritize your time and you don't see your family on other times that way, then you're just a crappy family member and stuff like that. And remember, and honestly, I mean sincerely, the majority of people don't want to hang out with the majority of their family.
That's true.
So why can't you say no? It's not a joke. So I get criticized from extended family because I don't go to their weddings because I haven't seen you in 7 years. So I just don't care.
Family
I don't want to go.
Yep.
Family reunions, no. And they say, no. But then they look and going, oh, but wait, look at the life you built. Look at that. Yeah, because what happens is you only have so much time. And me showing up for somebody's wedding that I haven't seen in 7 years, I'm sorry, no. Because you know why? It takes away from what we want to do in life and stuff like that. I'm going, and so I look at when people talk about priorities with them, I'm like going, if you can't say no to stuff and have your time man, because you know what's why funny? Chad and I, we can remember when we were 20. It was like yesterday, wasn't it? See, even last, it was yesterday. I next month, oh my goodness, in a couple weeks, I turn 48.
Yeah, you're getting old.
Hey, I can still outdo you guys. But no, get this though. But think this way: you blink and it's gone.
Yeah.
And people look back and I'm like, you're doing so much stuff in your life that doesn't matter. And without saying no, there's no way that you. And I can understand why people get depressed. Do you understand that most people are mad and stressed during holidays?
Oh yeah.
And it's like, because I gotta go here, I go here. I'm like, just say no. Well, but my mom be mad. Okay, so she's mad. Do you say him? And I'll say, well, you haven't spent time with your mom other times? Well, yeah. Well, then why are they so angry about one day? Yep. One made-up holiday, and Jesus was not born on December 25th. He wasn't. It's a made-up holiday. I don't celebrate Valentine's Day. I think Valentine's Day is stupid.
Yeah.
If you're a crappy person to your spouse, 364 days a year, and you have to scare flowers on Valentine's Day, what the hell?
Yeah.
Do you understand? I love when people rush for dinner and things like that. I'm like going, really? Why don't you take her out every week? You understand? And stuff. So I just don't get it. I just don't get it when it comes to life that way. And so I said, stop going to your holidays. And I said, because you're all stressed out about that way. And on top of it, I said, did you get to spend time with God, yourself, your spouse? Well, no. Well, those are the things you want to last long term. And it doesn't mean you can't have family on your priority list. It's just that you understand. I mean this sincerely. I love when people put here, and I'll say this very simply. With the exception of God and yourself, with the exception of God, anything you put in front of yourself, you'll eventually resent. You understand? Talk Jenny. she's got a really, really nice guy, really super nice guy. And if you get married, and if you put his needs above yours, and you take care of him or you, eventually you'll do what? You'll resent him. You see it all the time. You saying? He'll love it. He'll think it's wonderful. It's the greatest thing ever. You know what I'm saying? But then you'll eventually be like, you know, and that's why I said, but see, that's what people say you're being selfish. That's not, no. Here, you can't give him an empty cup. People say, Doc, you give to everybody. I'm proud of this. I'm proud of this. And I'm sick of people talking about saying it's prideful or arrogant. No, I work on myself so darn good, I can give to all these people every single day.
Yep.
And you know, like I said, and I do it for you, I do it for everybody that way.
You do.
And I consistently give like crazy, but I can't give from an empty cup. So when I get up early and I prep myself and I'm doing stuff like that, I'm putting myself, with the exception of God first, I'm putting myself before anybody so that I can trickle down the aspect of what happens that way. And so I have no problem saying, no, can't go to your wedding. Nope, can't do this. Nope, not coming for a Christmas. Nope. You saying? But they're not going, oh, this, no. And the reason what people do is they will, because they don't prioritize their own life, they don't understand, so they'll be critical of your life.
Yep.
Man, if you have time to be critical of somebody else's life, you're not working on your own. Ooh, that's a quote right there.
Yeah.
You saying? If you have time to criticize somebody else, you're not working on your own life. Because it's hard enough to get through the day with all the stuff going on and to not do it that way. So, and I'm sorry, there's just people out there that just like to create problems in their own head that way. And I see that when it comes to stress. Stop worrying. Stop worrying. You know what I'm saying? It's like only focus on things that you can control in life. Can't control your spouse, can't control your kids, can't control your friends, but you can control yourself and stuff like that. And then hopefully putting that together, you'll have less worry.
Yeah.
And more purpose. And learn to say no. Ladies, learn to say no. You know what I'm saying? It'll change your life forever.
Cool. That's all I have on my side. Do you have any more?
I do, but we'll save those because there's some long ones on there that way, because then we'll end up in our, so we're going to switch over that way. We'll get back to our last 10% and we will actually end the show that way. So, all right, we're back in just a second. All right, thank all you guys that had sent in all those questions. Like I said, even on my email, I'm looking right here. I got a ton of them that way. We'll be able to respond to them. Some of you guys had some beautifully long, awesome questions. Those will take a little bit more time than answer because, Brandon, we end up going over an hour for that question that way. It would be long that way, but speaking of that, so thank you guys for always sending in. But remember, stay interactive with us. That way, if I didn't answer your question, we'll get it to you via email, or we'll actually have another show that way. But if some of these are very good, I want to get them out to you. So my last 10% today is speaking about something that I had an idea a short time ago. And I will tell you this, I loved the news documentary. If you haven't seen it, please go out and see this, because this does relate to health, and it does relate to where politics and healthcare and government all come together, because I think it's absolutely vicious. I've seen this more on a very common basis this way, is doctors that will do transgender surgery is absolutely disgusting. And stuff like that, where they're destroying the female or male body to convert it to a different sex. I'm sorry, I'm hugely against it. Call me, like I said, all of you woke nation, call me a transphobe, call me that. It's not what it is. I actually understand the body, and you cannot do it. I can show one slide up that shoots down everything you talk about when it comes to transgenderism that way. So it's like, I'm sorry. And it doesn't mean I don't take care of these people. It doesn't mean that I actually don't have respect for them. I can honestly tell you, you guys heard my stories. I actually had a recent one that was a 17-year-old girl that thought she was a boy. I even called her by her boy name because I have respect for individuals. But as far as to accept it and see things that go on, I will not do that. And so I actually watched a documentary that I thought was well done that way, because I can see what they're doing. And Matt Walsh did it. It's called What is a Woman? And it's quite funny from a standpoint in this, it's quite amazing because here's what happens. So watch this. People always say, Doc, when do you think life starts? Okay, so I'm going to give you some opinions on this because I'm going to show you something exciting that I'm going to be doing shortly here. And we're going to be making our own documentary movie coming up. And here's what happens this. It's really funny. And they've even studied this. Do you understand that when the egg penetrates the sperm, there's a spark? They even have visual representation of this. It's kind of cool. And then here's what happens. The minute that egg penetrates the sperm, the female body starts to transform right then. Hormone levels change, body changes, blood chemistry, everything changes. Their immune system, do you understand? The minute the sperm hits the egg and it's fertilized, there is a reaction to the female body because that's when life starts. See, no one, I wish all these people that have these debates about abortion would actually call me and ask you, when does life start? I'm like, let's talk about it from just a simple biological standpoint of what happens. Because the only time the female body is like that is when life is inside of her. The minute that life leaves, guess what happens? Her body genetically goes back to the way it was before that sperm hit that egg. And it doesn't wait 6 weeks. It doesn't wait till it has fingers. It doesn't wait till it has a heartbeat. The minute that egg penetrates the sperm and that egg starts to change and there's fertilization, the female body starts to transform into a state that is nothing like that until that life leaves that body. It's the coolest thing ever. So people say, Doc, when do you believe life starts? When that egg is that sperm penetrates that egg. Because the whole biochemistry, even the whole psychology of a woman changes. And that only happens when that egg penetrates that sperm. So therefore, now let's go back into this next part. I get very frustrated when people are talking about feelings and things like that, because you know why? You think I'm joking. You can take a guy and give him estrogen, and he will think, and he will act, and he'll even experience things like a woman. But his body doesn't want to be that way. It always tries to go back to that state. It doesn't want high estrogen levels. It wants higher testosterone levels. It's like, for example, if you inject me with estrogen, my body's I'll probably even take on some characteristics, but my body will try to get rid of that hormone and get it out of there, okay? Because it wants to get back to the levels of testosterone and estrogen that my body is going to be at, okay? Now, the reason why I bring that up is when you look at certain things of how our bodies are produced, women's livers are different than men's livers. They are. Dr. Jenny, your estrogen levels, you can handle more estrogen levels through your liver than mine can. Dr. Carolyn, okay? Dr. Leslie, guess what happens? You know what I'm saying? But us guys, we can't handle the estrogen levels that a female can. That's why it's very different. They have different enzymes. You know, the CYP3A4, just that alone, I can disprove all of the things that people are talking about when it talks about the giving hormones to people and having high levels of testosterone or estrogen for a guy compared to a girl. I'm like, I can disprove it just from how the liver works, all right? But you know what's really funny? I'm gonna step back knowing all that stuff and what it leads to. So then when I saw Matt Walsh's What is a Woman, I get so disgusted when I see the medical field talking all emotional pander to the people instead of actually stand up what's right. It's really scary. It really is. So if you haven't watched it, go watch it. It's called Was a Woman, Matt Walsh documentary. It's on the Daily Wire and stuff like that. And I don't care if you like Ben Shapiro or not, stuff like that. Watch the movie. You can say it's fantastic. Okay, it's not a political thing. I actually like, he just went around and said, was a woman. Now, there's something I have done now since I was a teenager. And that's why it's so important to me now, is when I was a teenager, I had the concept of being healthy. That's what I was looking for. And so I wasn't looking to what our medical field is. When you ever look at the way they view the body, they view it in parts and diseases and cancers and things like that. But you know something is this? What's the opposite of being sick? It's being healthy. You're saying, and if you ask the average person if they're healthy, they'll say yes. Do you understand? Do me a favor. If you're going to visit your parents this weekend, let's say they're a little older, ask them if they're healthy. They'll say, yeah, if I didn't have cancer, I didn't have blood pressure, I'm a pretty healthy person. That's because they don't know what health is. So what I did, I started this a long time ago, and I kind of find it, everybody giggles with this. One of the slides I put up during all of my talks, I asked a simple question, is what is health? And the question I asked before that is, do me a favor, and I want you guys all to do this with me, sitting in the studio, sitting at home, please do me a favor. Raise your hand if you want to be healthy. See, I've got to do it. Raise your hand if you want your children to be healthy if you have them. How about for your spouse? How about for your parents? See, you just raised your hand for every person that you dearly care about, and I want everybody to be healthy because you don't want to see a sick person. It's very a lot of suffering. But here's the point. when I started to do this, and I started to do it way before Matt Walsh did, was a woman, you can go back to my earliest years before there was even PowerPoint. I would take the clear projector and I'd write some circles on there, and I'd write something that said, what is health? And I'd ask everybody in the audience. And when I was in Ireland, when I was in England, if I'm overseas, I'm here in the United States, if I'm speaking anywhere that way, do you understand that nobody knows what it is? Because you're not taught what health is. So I always ask people, what is health? Just like when Matt Walsh did, what is a woman? It's time, and I reached out to my brand manager, and I said, it's time. It really is. I've been thinking about this for a long time, and then when I watched the documentary, What is a Woman? And so it's something that when I was over in Ireland, I had some time by myself. I was actually, no joke, I was sitting over by the ocean, and I started sketching out a new documentary, and it's going to be, what is health? And I'm going to show you that I'm going to travel the world, and I'm going to go ask some people what it is. I'm going to go ask the biggest medical organizations, and I'll interview their PhDs, and I guarantee you it's going to be fun to see what they're going to find. Because you can't even get the most common person to tell you what health is. And so then I asked 2 questions for you guys after that. If you don't know what health is, how do you know if you're really healthy? And then get this, at my talk in Ireland, which these women were amazing, thank you so much for coming. There is a packed house, not a seat left open. There was only 2 guys there. No joke, it was a packed place of just women everywhere that way. And I asked them a question because I tell people, I'm not trying to be offensive, but I want you to think about this. Here's what I want you to think about. If you don't know what health is, how can you tell me that you're raising a healthy child? See, and I know you don't know what health is, not in a negative way. I know you don't because the doctors are misleading you and you think you have a healthy child. But on the flip side, childhood cancers, heart diseases, diabetes, obesity, psychiatric problems, kids taking medications is at an all-time high. So I know they're not teaching you how to raise a healthy child. Because if it was, healthcare wouldn't be some of the biggest debates in politics. People would not be worried so much about a virus running around. So I'm going to start working with my team. It may take us a year or so longer to produce it that way, but I'm so set now on it. I called my brand manager and said, man, we're going to start talking about this when I get back. Because even when I was in Ireland and England, when I asked people what it was, and I'll even hit the streets and ask people, what is it? And you're going to be surprised that people do not know what it is. And if we do not know what it is, there's no way you can accomplish it. It was so great to watch Dr. Sam guide, look at the words that the guy used. He guided him back how to get healthy. And it took his effort. And there'll be people out there that actually do not want to take the effort. So I asked a socialized medicine country. I said, who should make the healthcare decisions for you or your family? You or the government? They all said you. They all said, I want to take responsibility, not the government. And I said, then who should pay for the healthcare of people that don't want to take responsibility for the health and do 6 things and manage their body with medications and stuff like that, and for who should pay for it? And everybody said, well, they should pay for it. And I said, then why do you have a social medicine where people will not change their habits to accomplish what they want to change? And they all sat there and like, holy crap. That's why I will always be against any universal health care, because somebody that wants to sit on their couch today and eat Doritos, and eat bad stuff, and do all the bad things and say, it's my right, it's a universal human right to have insulin. No, it's my universal right to say, get your fat ass off the couch and get moving. But you can't do that anymore, because the woke mob will be all sad because you fat shamed them. No, like I told you before, when I was over across seas, or if I'm here alone, people are sick and suffering, and people are so worried about offending people and so worried about making people upset or feeling bad. But you know what something is this? Sometimes you need to feel bad. Sometimes you need to actually not feel good. It's not depression. It's not anxiety. It's actually, the sad part is this, and I actually have more empathy for people than being critical of it that way, because you weren't taught. But when you are taught, when you know better, now you can do better. If you know better and do nothing to it, that's the people I'm speaking to the most. Because I know there's an insulin shortage coming. All the pharmacists I talk to are very worried about it. You can actually read it like crazy that way. No, I'm not worried about insulin shortage. You know what I'm saying? Because you know why? Because if you have type 2 diabetes and you're dependent on insulin, and now there's no insulin and you die from it, you still kept your same bad habit that allowed you to do it. And so if you die, it's on you, it's not on me. And I'm not going to fork over more of my money so you can still have a bad habit and eat like crap and do bad things. Type 1's a little different. I blame medical profession for type 1, but that's a whole nother story. Because they trigger immune system and now they cause problems and all those autoimmune diseases, including type 1 diabetes. And that's why we see so much type 1 diabetes today. So I know my last 10% was a little bit intense today. But you know something is this? It was very intense this past travel when I did go over to Europe for a little bit and actually did go speak to people that were sick and suffering. And they came back and said, my doctor led me in the wrong way. Help. But there's also people on the opposite side that say, you're not an expert, you're not a real doctor, you're not a quack. Those are people I'm being a little more abrupt with, because those are people that are going to be the sickest and the most suffering, that will take it right to the grave. And I won't join you in the grave. I'll join the other people that are very purposeful and want to move in the right direction. And I'm very empathetic for people who are not taught, but then learn and then move in the right direction. So that being said, you guys have a wonderful Saturday. Thanks for joining me today. It's great to be back. I will see you guys next week. Thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Each week on A Different Perspective, we bring you the most cutting-edge information on health you won't find anywhere else. For more information on this topic, please visit our website. A Different Perspective offers life-changing information and resources to share and explore. A Different Perspective is leading a health revolution.